على طول لأنه I need volunteers to answer. Okay. All right. So. Okay. هتكون it's going to be a revision. So first of all, we're going to start with this exam. So what is this study? What is the projection? What is the posture and the coverage? Any volunteers?
X-ray.
Okay. What part of the body? واحد منكم يجاوب. Abdominal X-ray. Okay. What is the projection? Anyone? What is the projection here? It's anterior posterior. Okay, so it's AP. What is the position or posture?
Supine.
Supine. Okay, excellent. How do you know it's supine? هو في العادة هيكون مكتوب هنا إنها supine، لكن هنا مو مكتوب، بس كيف عرفنا إنها supine؟
And spine of vertebra.
Spine of the vertebra.
عشان الجازز موجودة تحت.
Yes, الغاز are يعني there's no air fluid levels, okay, especially in the stomach. The abdominal gas or the bowel gas is evenly distributed. Okay, so what is the field coverage? Is this adequate or inadequate?
Inadequate.
Why?
No symphysis pubis.
Symphysis pubis is excluded. Yes, excellent. What else?
The diaphragm.
Diaphragms, yes, and the lung bases. Excellent. Okay, next case. What about the technique for this? Sorry, did anyone have questions?
Yes, Doctor. Can you send the lecture, please, عشان نكتب الملاحظات معك?
Okay, طيب. بس كده هتعرف الأجوبة أنتوا. All right. طيب next case دحين أرسل لكم هي. Assess the technical quality of the following image.
Not enough X-ray.
Not enough. Okay, exposure, yes, or penetration, yes. So إيش المفروض يسووا? Increase the dose. Yes, because this is a big patient or fat patient, you know, big abdomen. They will need more X-ray, more penetration. Okay. Identify these structures. What is this?
Large intestines and the small intestine.
Which one is the large and which one is the small?
Left is a small.
Okay. And how do you know it's small? Small bowel is not colon. What are the ways to differentiate between the small bowel and the colon and the
diameter?
الهوسترا.
Okay, Hastra. Where do you see the Hastra?
In the colon.
The right
In the
side.
colon. Yes, in the colon. Excellent. And the abdomen, the small bowel has these continuous or complete lines that are called what?
Plica circularis.
Plica circularis, yes. or valvula conventus. Yes, excellent. So this is small bowel, and this is colon. Okay, the colon has hostra, which are incomplete lines or folds, but the small bowel has complete lines. This is one way. The other way is to differentiate small bowel from colon is the position, right? The small bowel is central, is in the middle of the abdomen. The colon is in the periphery, especially the ascending colon and the descending colon are on the sides of the abdomen. Okay, so now we are going to identify some structures, okay? What is this organ? دقيقة.
liver,
This line here. There's one here and one here. Extends from here or all the way down.
Psoas major.
Psoas
Kidney.
major. Psoas major. No, the kidney is here. Here is the kidney. Okay. Psoas major. Okay, excellent. Vertebral body, right? What is this circle? What is the name of this circle? Here, 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 on both sides.
Transverse process.
No, this is the transverse process, this line. But what is the name of this circle?
Pedicle.
Pedicle, yes. Excellent. What is this?
Bladder.
Bladder, yes, excellent. All right, so bladder, psoas major, vertebral body, pedicle, kidneys, liver, spleen, and so on. Okay, nice. What is the name of this exam?
barium study,
Okay, it's barium study. Yes, so which barium study? You were right, but the answer is incomplete. So this is called barium meal, okay? Also known as upper GI fluoroscopic exam. So the purpose is to see the stomach and the duodenum. So what structure is this?
Stomach.
Which part of the stomach?
Fundus.
Fundus. This one?
Body.
Body, okay. This one?
Pylorus.
pylorus,
Again?
Antrum.
Antrum. This is pylorus. And this is
Duodenum.
first part of the duodenum, yes. Okay. What is the name of this exam?
barium enema,
Barium enema, yes. Identify the anatomical structures.
cecum,
Cecum.
Theca. Nascent.
Right brachiflexion.
Flexure.
Hepatic fracture, excellent.
transverse colon,
Transverse colon. Descending
ascending
colon.
Descending.
Appendix or sigmoid colon.
Sigmoid, yes, this is sigmoid. Appendix, this is the appendix, it's very small, this white line here. But I think it is pointing towards the sigmoid colon. Okay. All right. Again, name. So what is this? What kind of a study is this?
CT.
CT scan.
MRI.
CT. It's CT. No, it's not MRI. It's CT. Once you see the bones are white, you know this is CT. Okay, because MRI does not show bones like very white. What is this?
pancreas,
Pancreas.
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 What is this?
Gallbladder.
Gallbladder.
What is this?
Urinary bladder.
bladder,
What's this?
spinal cord,
Rectum.
Rectum. What is this?
pelvic bone,
Which bone?
Sacrum.
No.
iliac.
Iliac. It's part of the iliac. The lower part of the iliac has at the hip joint. It is called
Humerus bone.
acetabulum. Okay. Which side?
Right.
Right side. That's because it's labeled here right. And you know this side is always right and this side is always left. Okay. So what is this?
Stomach.
Stomach. Okay. What is this here? Hepatic flexure, right? What is it? All these?
Collex of the area.
Jejunum.
Small.
Small bowel. Okay. And this one here next to it?
The left corner.
Yes.
Left column.
Descending colon. Okay. I know you have the slides now, but and these are the renal pelvis. Okay. What is the name of this exam?
Angiography.
Try again. So what is the modality? Is this a CT? Is this ultrasound? Is this MRI? Is this X-ray?
CT.
It's an MRI. This is called MRCP. Have you heard of MRCP before? And what does it stand for? Or why do we do MRCP? It's magnetic resonance, cholangio, pancreatography, right? So it's magnetic resonance, which means it's an MRI. Cholangio means we image the bile ducts and bile system. Pancreatography means that we image the pancreatic system, all right? So which makes this structure is
Gallbladder.
gallbladder. This one is
Hepatic duct.
okay, another answer.
Pancreatic duct.
Pancreatic duct. This one,
The hepatic.
Hepatic.
which side?
And left side.
Left hepatic.
Left hepatic duct. And this one?
Common hepatic.
duct.
Common
Common
bile.
hepatic
hepatic.
or common bile duct. It depends. What is common hepatic and what is common bile duct? How do you differentiate?
Common hepatic before the
Common
cystic.
hepatic.
Before the cystic duct. Excellent. And this is the cystic duct, okay? So this segment above the cystic duct joining is the common hepatic, and this segment is common bile duct all the way down to the ampulla, okay? So I gave you the answer. This is common bile duct, right? Okay, so again, this is abdomen X-ray. So what is your comment on the technique? Is it adequate or inadequate?
Adequate.
So we said we have to include the symphysis pubis, which is included. We have to include the flanks, which are included, but we also have to include the diaphragms and lung bases, which are not. So this is technically inadequate film. But so what are the findings, or what do you see?
Dilatation in the left kidney.
Dilatation. What is dilated?
The pelvis.
Renal pelvis. Why is it dilated?
Obstruction.
Hydronephrosis.
Stone.
So what looks white on X-ray?
Staghorn stone.
Okay, staghorn stone. Okay, stones in general look white on X-ray, right? Why? Because they contain calcium, and as you know, calcium, which is also present abundantly in bones, and bones look white. So anything calcium containing will look white on X-ray. Okay, so what do we see here? We see large, and one of you said staghorn stone in the left kidney and collecting system. This is the left collecting system. This is the left pelvis, renal pelvis of the left kidney. What else? Is that it?
A stone on the right side.
Yes, there is a stone in the right side. Yes, make sure that you check both sides. Make sure you check every structure in the image that it doesn't have pathology. Okay, don't be distracted with the main finding. All right, excellent. Next one.
A stone in the urethra.
Okay, yeah. So in the urethra, maybe very low in the bladder. Yeah, this is most likely in the urethra down here. Yes. All right. So IVP, IVU, they're not really done anymore, but it's part of the history of the abdominal imaging. This is like a OS, the staghorn stone, how it looks like. And what are these here? Stones in the bladder, right? Okay. So in IVP, how do we do it? We inject contrast. طيب نعطي صبغة في الوريد وننتظر 5 دقائق. Okay. After 5 minutes, the kidneys will excrete the contrast, and this is how normally it should look like. Okay, but if there is a stone, it will be dark or lucent, or there is filling defect. Okay, as because of the presence of stones like these staghorn, when we give contrast and the kidneys start excreting the contrast, they will be filling defect because of the stone. All right, and on the image it will look lucent. All right, so this was X-ray. Moving on to ultrasound. So what is happening here?
Kidney stone.
Kidney stone. Okay, so stones look white on X-ray, they look white on ultrasound. All right, here, what is happening here? This is dilation, okay? This is, yeah, this is hydronephrosis. Large renal pelvis, large calyces. All right, and here is, so we are down in the pelvis. This is the bladder, and this is the ureter, which is dilated because of
Obstruction.
an obstructing stone. Yeah, there's a stone at the distal ureter. The ureter comes here and joins the bladder, and the proximal segment above the stone is dilated because of the obstruction. Okay, and hydronephrosis can be graded into 5 grades. All right, so IVP. This is IVP. It's not done anymore. This has been replaced by CT. Urogram or CT only, but the same findings that you see here, you will see on CT. Okay, but just because the CT gives you more details. All right. So again, we give the contrast into the vein of the patient in the IV push, and then after 5 minutes, it will be excreted, so we can easily image the collecting system, the ureters, the bladder, see if there is any obstruction, any lesions, and so on. Okay. All right. So IVU, IVP. I'm not going to spend time because it's good to know that maybe some places do perform it, but it's been largely replaced by CT. Okay, because it will give you a lot of details and more anatomic information. So what is this exam?
CT.
Okay, so what is this arrow pointing to?
Classification.
Stone.
Calcification. Okay, you're right, but it's a stone. What about here? What are these calcifications?
Stone.
Where?
Gallbladder.
Gallstones, yes.
Right.
Okay. Okay, so again, as I mentioned, the CT now is, has replaced IVP studies because we can see a lot more details. I mean, but it comes at the expense of extra dose of radiation. But other than that, we always do CT, all right? Okay, so one technique is CT urography. We do first scan before giving contrast, which is called enhancement or unenhanced, to check if there's any stone. And then we inject contrast, and we do it in different phases, okay? The first phase, we do it 15 to 20 seconds after giving the contrast, and this would allow us to evaluate the cortex and the cortico-medullary junction and any vascular abnormality. And then about 2 minutes after the injection, we repeat. So we scan one more time. So this is the third scan. At the same time, we assess the parenchyma. This is called the nephrographic phase. And the last phase is done about 5 minutes, 5 to 7 or 8 minutes after the contrast is excreted from the kidneys into the pelvis and ureters and bladder to assess the urothelium, okay? Because sometimes there are tumors and masses develop in the urothelial system, all right? So this is CT urogram. So be aware it's 4 scans. So it is equivalent to someone who is getting 4 different scans. So before trying, or before ordering this exam, just be aware that this is considered as 4. The dose, the radiation dose, is equivalent to 4 exams. Okay. So what is this exam? What is this study?
Ultrasound.
Ultrasound. So what are we looking at here?
Kidney.
Kidneys. Okay. Which one is normal? Which one is abnormal? Or are both normal or both abnormal?
A normal and B abnormal.
So A is normal and B is abnormal? Is that what you said?
No, B normal.
Okay. Do you remember my lecture from last year when we ordered when we mentioned the order of the echogenicity of the abdominal structures, right? We said the most hyperechoic organ in the abdomen is, you don't remember, right? Okay, so it should be the pancreas, the most echogenic or hyperechoic. Okay, so the second answer was correct. This one is normal, and this one is abnormal. The cortex of the kidney should look darker than the liver on the right side. Okay? Or the cortex should look darker than the medullary segment or the medulla of the kidney. Here, the cortex of the kidney looks similar or even higher in echogenicity compared to the liver. This indicates that this kidney is diseased. Most likely the patient has some kind of chronic kidney injury, okay, or renal failure of some kind. So remember, we always try to compare the renal cortex with the liver on the right side to assess for the echogenicity. All right, so again, kidney ultrasound, what do we see here? There's a brown, dark thing here. What is it?
Maybe dilation.
Or?
Cyst.
Cyst. Okay, so how do we describe a simple cyst or any fluid containing structure in the body with ultrasound? When we see it dark like this, what is the term that we use?
Hypoechogenic.
So Hypo means decreased, but if it's completely black, hypo means decreased relative to the adjacent structure. But if it's completely black, we call it anechoic, right?
Anechoic.
Anechoic means there is no reflection of the echoes whatsoever, right? Because the echoes will pass through this cyst completely without any reflection. Okay. Here, what about this one? This is described as hyperechoic to the adjacent renal parenchyma. Okay, this is hyperechoic and this is anechoic, and the kidney parenchyma is hypoechoic relative to the kidney. So it's all relative to the nearby tissue. Okay. All right. So if you are faced with a renal mass, if it looks like a simple cyst like this one, stop. You don't need to do anything else. If it looks like a solid mass or complex cyst, you then do a CT or MRI with contrast to further evaluate. Okay, and if it's a mass, you look for other findings such as renal vein invasion, IVC invasion, and fat invasion, and so on. Okay. What is happening here? So this is an IVP. This is CT urogram. Again, CT urogram. What is happening here? So the kidneys are executing the contrast, but there is a filling defect here in the right renal pelvis. So this is an example of urothelial tumor, and the most common is transitional cell carcinoma, or TCC. Okay, it's the most common urothelial tumor in the urinary system. Okay, it's highly associated with smoking, and this is how it's diagnosed. All right, so what are the advantages of MRI? Excellent soft tissue delineation, right? So the contrast and the detail of the soft tissues will be much greater compared to CT and ultrasound. There's no ionizing radiation, so there's no harmful radiation in MRI. And it can be done without contrast, with a lot of details, okay? So moving on, this structure here, what is the exam and what organ do we see here?
Ultrasound.
What kind of ultrasound? You see the shape of the probe here, right? So this is called transrectal ultrasound. Okay, it's through the rectum. And why do we do transrectal ultrasound? To image one organ, which is this one. In males.
Prostate.
Prostate, yes.
Prostate.
Prostate. Again, so we can do it. We can look at the prostate from the transabdominal, the routine ultrasound, but also more details with the transrectal. Sometimes we can also do biopsy. Okay, we can take a sample from the prostate in case of suspecting prostate cancer. All right, this is you know what's this one, right? Only a few days ago we saw an example of it. If you attended the lecture.
Thyroid.
Thyroid, yes. What are the parts of the thyroid? Which part is this?
Right lobe.
Right
Right
lobe.
lobe.
Right lobe.
Okay. Left lobe. This one is
Isthmus.
Isthmus.
isthmus. Excellent. Okay. So how do we measure the volume? So we get the width, length, and height, and we multiply it by 0.52, right, or 0.51, right? Okay. What is happening here in this thyroid?
Mass.
There's a mass or a nodule. Yes, there's a nodule here. Okay. What is this? What is this structure, the white lines here?
Trachea.
Trachea. Excellent. Yes. Okay, so we're almost done. What is happening here in this exam?
Doppler.
Sorry.
It's Doppler.
Okay, this one is Doppler, yes, but what is the pathology? What is happening?
Increase the function of the thyroid.
High pelvis. Right?
So we cannot assess the function. It's not a functional imaging, but I agree. Yes, I think you want to say the gland is enlarged and hypervascular. Yes, which is seen with
Graves?
Graves' disease.
Hypertension.
Disease.
Yes, excellent. What about this one? Okay, so this is the trachea, just to orient you. So all this are
Multiple nodules.
multiple nodules or multinodular goiter. Okay, this one.
Stone.
We don't usually get stones in the thyroid. These are all thyroid images. So this is a nodule. This is a nodule, okay? Is it benign or malignant?
Benign.
Yes, this is called colloid
Benign.
cyst. Colloid cyst because of this artifact. What about this one? This one looks ugly, right?
Malignant.
Yeah.
Malignant.
Do you remember the name of these white dots?
Macro calcifications. Or micro.
Microcalcifications. Yes, microcalcifications. Very suspicious. Excellent. All right. What is this?
Functional.
It's functional. Yeah, we don't
Functional.
call it functional. It's a type of nuclear medicine scan. This is called thyroid scintigraphy. Yeah, or thyroid scan. Yes, excellent. So what is the problem here?
Hot nodule.
Hot nodule, yes. And what is the problem here?
Cold.
Cold nodule.
Cold, yes. So hyper-functioning nodule and hypo-functioning nodule. Okay, so that was it. Thank you all again for coming, and then wishing you best of luck. Any questions?
دكتور
Yes.
ممكن أسأل من ناحية الثايرويد ألتراساوند
Yeah.
سمعت إنه في فرق باللي هي الهوموجينيسيتي يعني يمكن يكون heterogeneous يمكن يكون homogeneous صحيح
Yeah.
كذا؟ طيب إذا
Yeah.
كان heterogeneous هذا يدل على ماذا؟
Okay, good question. It doesn't tell you specific disease. It just tells you that the thyroid gland is abnormal. Okay. Can you see my screen now?
Yes.
So this thyroid is very irregular or like heterogeneous or heterogeneous. Okay, so it tells you without turning the color on, it tells you this is an abnormal thyroid gland. Okay, but what disease exactly, we don't know. All right. Ideally, we want to see it very homogeneous like this, uniform, with the same echogenicity, same texture, very straight and uniform borders. This is how a normal thyroid gland should look like. Any other questions? Okay. Thank you again, and wishing you best of luck. Assalamu alaikum.